Hey, everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director of Clinical Education and Partnerships at SICA, where we partner with healthcare providers to offer body composition solutions. And today I'm joined by Dr. Trupti Patel. She's an obesity medicine physician, and she's the founder and medical director of Physicians Premier Weight and Wellness Center in Northern Virginia. And she just opened her third site and has been an early adopter of medical body composition, has been using it in practice for at least 7 years. And so I thought she'd be a really good person to talk to us about how to make body composition work in your practice and really kind of dive into the logistics and kind of the flow in your clinic and what's making that work for you since you've been such a fan.
Thank you, Nina, for having me. I'm so excited to be here and share some of my experiences.
Great. Well, yeah. So tell me a little bit about sort of what initially got you interested in it. I know you've been in obesity medicine for a while. Why did, you choose body comp 7 years ago before it was really being talked about as much as we see it talked about here today?
No, absolutely. So, I started as a family practice physician. I was doing that for just a little over 20 years before I went into obesity medicine. And so initially, I did obesity alongside primary care. And, the obesity side of my practice got busy very, very quickly. That eventually decided to focus 100% on that. But after I did my board certification, I really, really looked into wanting to provide just a full comprehensive approach to obesity. And one of the things that really stood out in my training was we talked a lot about BMI and how BMI is not always the most accurate way to approach weight loss. So I looked, at some of the resources that were out there, and Sika was one that stood out to me, and I really liked the layout of the reports that it generated. I think patients, the more data on it, sometimes the more patients really enjoyed looking at it and talking about it because they had a hard copy of what's going on inside that unfortunately the scale does not tell them. So I think it, and not just for my patients, but even for me, the ability to see what was happening as they were losing weight, what was happening to their muscle, their fat. That type of information is priceless. And I think it also was a great motivator, is a great motivator for a lot of my patients when they look at that kind of data.
Absolutely. Yeah. Which do you show everybody everything, or have you kind of narrowed down to select a few that really work and kind of complement what you're actually counseling them on?
Yeah, so I actually, because and there's a lot of really, really good information, and sometimes it can be difficult. You may not have enough time to go over all that information, but I usually select 4 or 5 things on the report that I like to go over with my patients face to face, and then I give them a copy to take home. And a lot of times they will kind of go through the numbers at their convenience in a little bit more detail. But I always pick the 4 or 5 things that I think are really, really important to follow.
Okay. So do they tend to always be, do you have like your top 4 or 5 that you talk through?
Absolutely. One of the ones obviously we look at is fat mass, in pounds and in percentage, because really the whole one of the goals, the biggest goal with weight loss is we're going to look at fat mass and getting rid of fat mass and how they as they progress. So fat mass is one. We always look at muscle mass because that's very important. We want to make sure they're preserving as much of that as possible. We're looking at visceral fat because obviously we know that plays such a big role in their health. So visceral fat is another one. I always like to show them that graph that they have, the body composition graph, where it puts them in one of the 4 quadrants. And I think it's nice to see that them progress when they look at that dot and trying to aim for that right lower quadrant, which is where they have good muscle mass and low fat mass. So those are the fours that I really try to hit every time they come in.
I actually love that. Those are probably the four that I like the most too. And for me,
Yeah.
that kind of relationship between the fat mass and the muscle mass together on one chart, I really like. And I think, I mean, I know my thoughts about how I ask or talk to folks about it. I usually I'm looking at, what would we do differently if someone was in each of those four quadrants, right? And so for someone who's coming for
Exactly.
obesity treatment, they're most always going to have a high level of adipose tissue,
Mhm.
but the skeletal muscle mass is where they differ. And so
Yeah.
how do you approach differently if someone's really in that like top left quadrant would be
Yes.
low muscle mass versus
Mhm.
somebody who's both high fat and has a good amount of skeletal muscle that you're not as
Mhm.
worried about them losing when they have a treatment.
Absolutely no. So I agree. I think, depending on where they are in those quadrants, it helps to guide the type of treatment, whether it's from a dietary angle, exercise, even behavioral. And unfortunately, that top left quadrant, where you may see a lot of patients who have a normal or even just a little bit higher BMI, but sometimes they will fall in that top left quadrant because they have low muscle mass and high fat mass, sarcopenic obesity. And we see a lot of this in many of our postmenopausal women because they lose some of that muscle mass and unfortunately put on fat mass. So, that quadrant, absolutely, we really focus on strength training,
Mhm.
improving that muscle mass, getting adequate protein in, so absolutely, so depending on which quadrant they're in, we're going to give them more specific guidance.
Do you tweak or change the the medications they're on if they were to start there? Would you start them slower, titrate them up to dose a little bit slower, or maybe even bring them in more frequently?
Mhm. Often that will depend on how they are responding to whether it's the dietary changes, the exercise, if they're struggling with a lot of hunger, cravings. So a lot of the medication piece of it will depend on that. I mean, you know, medications do have, you have to have a certain BMI to prescribe a medication. So sometimes those patients that are in that top left quadrant, may be below a BMI of 27. And may not, the insurance may not pay for some of those FDA approved medications, injectables, and some of the oral medications. So that's where, we really try to focus on more specific lifestyle changes, strength training, that type of thing, so can they have a better response.
Awesome. Yeah, I think we're just hearing more and more about sort of the precision and the individualizing and, some of those buzzwords. But I think what that really highlights to me is that, we're giving people different insights towards their body and their body changing. And how we're approaching them just depends on that person. And so I think that's
Exactly.
really,
Exactly.
to me,
You
that
know,
comprehensive care really means individualize the approach
I
based on their
agree.
numbers and how they're responding. So I love that.
hmm No, that is so, so important. I think that individualized care, I mean, every single person is different. It's not one size fits all, right? When it comes to weight loss. And I think you have to look at everything. You got to look at their history. You got to look at what they've done before. You got to look at, stress levels and how they're eating. People have food restrictions. I mean, there's so many things that you have to look at. And I don't think it works unless you individualize it.
Totally. Well, one other thing I wanted to just kind of explore with you is how do you actually have your Tika body comp analyzer set up in your practice? Like
Mhm.
who's doing the measurement, who's reviewing the measurement? How does that flow? That's a question I get asked a lot when people are thinking
Yes.
about how that might fit in their practice.
Yeah, no, I think we've done a good job streamlining that really well. We have a Sika analyzer at all three of our offices, and so typically we have a designated room for it, and quite honestly, it doesn't take up a lot of space. We use it for other things also, like it's like a multi-purpose room. But in my practice, I make sure that all of my clinical team is trained to do a body composition. So it could be me, it could be my one of the NPs, nurse practitioners that's there, our MAs. or even my office manager. So you always make sure that at least half the staff knows how to do it. And because it's something that's very quick to do, and if an MA is busy putting a patient back, then somebody else can jump in and do that test. So it's very easy in that standpoint. We have plenty of staff, and it's very easy to train staff how to do it. They actually enjoy doing it. Um, so that's one
I
piece of it.
bet.
As far as who, most of our patients actually enjoy, they love to see the results. Um, so as far, we do a lot of meal replacements. We offer a lot of injectables for weight loss, Wegovy, Zepbound, some of those medications. And our patients are educated very early on that these medications, especially if you don't have a right dietary plan, can decrease your muscle mass as you're losing weight. So it's very, very important that we track their body compositions regularly. So our patients understand that. So we have a large number of patients that get these compositions done. So that's why it's very important for us to make sure that we have adequate staff to do it.
Great. So how often are you having somebody on medication or on a meal replacement? Do they do it every
Mhm.
visit, or how often are they coming into
Mhm.
you?
So as far as medications go, I think about 85% of our patients are on some kind of medication for weight
Okay.
loss. Because look, at the end of the day, we're treating a disease. We're treating a chronic disease, and we know that they're diet, lifestyle changes, that's the foundation. We've got to make changes there. So that's where we focus on getting them adequate protein, meal replacements if needed. Our patients have a choice whether they want to use meal replacements or not, but we do really focus on getting those proteins up. And then obviously we use those medications as a tool. There's so many people out there who do all the right things and they still struggle. So we
Hmm.
know there's a disease component to it. So often these
Absolutely.
medications are needed as a tool to optimize that dietary plan. So yeah, we often have patients that are on meal replacements to varying degrees. Some will use 100% meal replacements, some kind of do half half.
Okay. And they're coming in how often to see you?
So our patients come in, initially they may be coming in weekly, and other times they're coming in every 2 weeks. Maybe once they've been into the program 6 months, they may be coming in every month. But we always want to make sure that they have a lot of accountability, and even that isn't set in stone. If we have somebody who has, maybe type 1 diabetes, we want to monitor them more closely. We may have them come in more frequently. If somebody's really struggling, we may have them come in more frequently. So even that we try to individualize based on the patient.
That's great. Awesome. And so another kind of question that I get a lot that I want to hear your feedback on is just um, in different kind of body comp analyzers have different sort of reporting. I love that you're loving ours. Do you show them the results on like an iPad or computer screen in the office? Do you print it out? Do you give them
Mhm.
access to the app so they can look at it at home, or some version or individualized version of all of that?
We often people love us and they love to have it in their hand to look at. So a lot of our patients like to have a printed, and we print it in color. So they see the red, and the green, the different colors. So most of our patients ask for a printed copy, but we are able to upload it into their file, and then we can even email it to them as a PDF. So they have, that available as well. But a lot of our patients like to take a hard copy, which is fine. When they're there, we look at it. Sometimes we'll print it, sometimes we'll have it on the screen. And what we love to do is obviously compare to their previous ones. So the Sika, the software or their website that we use gives you the ability to very easily look at the current report, and then you can look at the previous ones. And it's nice to be able to show patients those trends on the computer.
I love that. Yeah, there's
Yeah,
there's
everybody
some
loves to look
cool
at those
stuff where
graphs. you know.
Yeah, there's some cool things that I've been working on, sort of thinking about for future iterations of software for charting and all of that. Looking at weight loss and maybe even the composition of what that weight loss is made up of. So, are
Yeah.
there any, like, what would be some dream options for you if they're if we're working on something new? Anything that's itching in the back
Um,
of your head that you'd love to see?
I would love to see, it would be great to see everything in one report where, where you can graph out muscle mass as it increases or decreasing fat. And I always think, for instance, when it comes to weight loss, I always like to show people a graph of the numbers. Many of the EMRs have that. And I
Hmm.
think patients love to see that on one screen, just that simplicity to where something is graphed out to see that kind of data. Because again, it's these little things that I think are super, super motivating for so many patients. For instance, when they see a graph of their weight, maybe they started a year ago. And I always tell people, look, your graph is never going to be a straight line down, right? I wish that was the case,
Exactly.
but that's not how life is. It's always going to have these little ups and downs as long as it's trending in the right direction. So having those kind of data points to put in one graph is kind of nice to have. I don't know if the new software has the ability to do that or not.
Well, we've got the trending look that you can see all the data points for each parameter, but there's some other, kind of looking at of the weight that folks have lost. I'm kind of thinking about, one of the numbers people are looking at when they're looking at the research studies, even of
Mm-hmm.
comparing, is it fat free mass? Is it lean body mass? Is it skeletal muscle mass? Of course, those terms, there's a lot to dive into there, but what's happening to those numbers as it compares to research, right? Or even as
Yeah.
percentages. We talk a lot about, this medication is associated with, 15 to 20% of body weight loss. So I think sometimes looking at where someone's at from those maybe more national benchmarking data points
Yeah.
could be interesting.
Oh,
Um,
absolutely.
and
Absolutely.
then thinking, I just try to listen to when people are saying, oh, yeah, and I write this on the side, or I calculate this for them. So if there's anything like that, I'm listening to that and trying to think of how we can incorporate that into a future
Yeah.
generation of, the software so that you're not having to do those calculations
Yeah.
on your own. And I
Yeah.
do
And
think
I'll
that's
tell
one
you.
thing that's kind of
Mhm.
cool is that we're for me, I'm able to see, every quarter we come out with a software update. And so when I get to influence, what some of those things are, that's exciting. And then being able to just, for you, not have to really do anything and have an update. There's so many with technology, of course, there's so many things that are still clunky in that regard, but I like being able to have that cloud-based software rather than the older school version where it was maybe a server and you have to download something specific. So
Yeah.
that's something that I think has been a pretty neat tool as well.
I agree. I agree. The cloud-based is much easier. I mean, because I've used the older version also, but it's so quick and it's so easy to access. It is so easy to access. So it definitely saves a lot of time and a lot of printing.
That's awesome.
At the end of the day. So and patients can have it. They have it in an email or as a PDF. So it's something that they can always refer back to.
Yeah, and then the other thing I wanted to just ask about, and you mentioned it briefly, is that you now have three locations, and so scaling your practice. I think sometimes people have, the issue of how am I going to get funding for another location, but it sounds like you're busy enough and you've found value enough to have it at each location, and I'm sure that's important for consistency across. If somebody shows up at a different location, they still have access to the same
It
device.
is. It is. I'll tell you, I don't think you can do practice obesity medicine without a good body composition analyzer. I think it's a must. Um, Only because, you see such a wide variety of patients. And yeah, many of the patients you can follow BMIs, but I'll tell you the it's not, it's not all as far as accuracy goes. You still have patients at the lower end, at the higher end. And like I said, we have a lot of patients on GLP-1s,
Mhm.
and many patients aren't, it suppresses your hunger, often significantly. And a lot of times people aren't eating the right types of foods, especially getting in the right type of protein. And it truly does affect their muscle mass. I mean, the last thing I want somebody to do when they're losing weight is to lose majority muscle rather than fat, and then they end up being in that left upper quadrant we talked about earlier. And so that's why I think it's so important to make sure patients realize that hey, yeah, you can absolutely lose weight by eating less, but what are you losing, right? Are you losing muscle or are you losing fat? Because we want to keep muscle, we want to keep as much of that as possible.
Yeah. Well, and the way you said that actually I think is really important, that it's like it's your responsibility if you're prescribing something to do this, but also I think it's consistent with the philosophy of a lot of folks that I've, talked to in the field, is like we're telling people it's not all about your weight. It's not a one size fits all.
Hmm.
Medication, diet, exercise, any of those components are not something that you're just going to tell everybody the same thing. So I think that
Exactly.
also helps to show them that that's what you mean. So you can't be saying that with your words and then not having an outcome metric that can actually be individualized. So I think that helps even
Exactly.
in that consistency of your brand and
It
of
does.
your treatment philosophy.
It does. It does. And and you're also going to see times where a patient will come in. Maybe they've been working out a lot, especially maintenance, right? We want our patients to do a lot of working out, do the strength training. And I have seen patients come in and they may have put on 5 pounds in their last visit. And so a lot of times they get really upset, right? Because they worked so hard to
Mhm.
get to that goal weight and now they're 5 pounds higher, and they're thinking, oh my God, is this going to be continue? And then often I'll have them do a body composition. I say, let's see where things are at. And they may have put on muscle mass, right? And so you show them those results, and you know how nice that is to reassure a patient that, hey, you're doing great. I want you to keep what you're doing. This is muscle. You're not gaining unhealthy fat. So there's so many of those patients that you will see also. So these are some of the other benefits that you get with it.
I love that. Definitely not a cut and paste all or nothing kind of a world, that's for sure.
Oh, definitely, definitely. So I agree.
Awesome. Well, thank you so much for chatting with me today. It was really, I loved hearing more about what you're doing and really the nitty gritty of that, because I think, when people envision getting body comp in their practice, sometimes it's abstract. And so I feel like I got a good sense of how that works with you and what you're focusing on, and it's working. And I think your patients are happy and you're able to show them their success. And that seems like a really good place to be.
Absolutely. We love doing it. So thank you for having me.
Of course. Well, I will look forward to seeing you at the next meeting, wherever that may be.
Yes,
And
I'm looking
thanks
forward to it.
again. How do we get people in touch with you if they wanted to connect after this?
Absolutely. They can, my website is probably the best place to go. It's healthymeweightloss.com. All one word, healthymeweightloss.com.
Okay, perfect. All right. Well, I'll put that in the show notes and send everybody there, and I'll see you soon.
Sounds great. Thank you so much, Nina.
All right.
I had a
You're
wonderful time.
welcome. Take
Thank
care.
you. Bye.